And if we can find a mechanism, on what makes the child outgrow the allergy, then we will be able to cure allergy. But we don't know the mechanism, so it means we still cannot cure allergy. Now it's all about the skin. In the past, we thought that eczema was a consequence of allergy. But the last 5-6 years, actually since this century, we know it's not true. We all were wrong. Eczema is not a consequence of allergy. Allergy is a consequence of eczema, because it starts with a bad skin barrier. And there are now 4 types of skin barrier defect, and I'm sure there are more. We are still in full research to find all the types of skin barrier defects. But now, for the moment, we distinguish 4 types: a physical barrier, and this is mainly made up by skin barrier proteins. And one of the most important deficiencies that we found nowadays is filaggrin. And in Singapore we have a lot of filaggrin deficiency in Chinese children. But it's different from country to country, because the mutations we found are totally different compared, for instance, to Europe. The microflora, the germs, are so important. And you have good germs and you have bad germs. And you should get rid of your bad germs, but you should treasure, you should keep your good germs. And one of the causes of allergy, or one of the factors involved in allergy, is antibiotics. If you prescribe a lot of antibiotics to young children, you're going to kill their commensals. And they need their commensals to build up a good immune response. So usage of antibiotics can be linked to allergy. Yeah? And the third type is the chemical barrier. So we have substances in the skin, and we call them antimicrobial proteins that kill germs. And the fourth is immunological barrier. So we have 4 types of barrier defects, or a combination, that can cause eczema. And for the moment, most research is focused on physical barrier. But I'm sure in the future, for all type of eczema, we will find a barrier defect. For the moment, we can explain about 30%. 30% due to filaggrin deficiency have a barrier defect. But we need much more research on this. So it's the skin barrier defects, and that's the beginning, that's the onset. It's the skin barrier defect that cause allergy, that cause abnormal skin colonization, and one of the germs that is involved in eczema is Staph aureus. The Staphylococcus aureus is a very important maintenance factor of eczema. And if you are a doctor and you forget to kill the staph, you cannot treat eczema. Because corticosteroids is only part of the treatment. And if you only prescribe corticosteroids, your germ will survive, and it will look like your corticosteroids do not work anymore. And the parents will tell you that the child has become tolerant to the corticosteroids. But that's impossible. It is because the infection continues and more germs are colonizing the skin. And if you have ongoing eczema for a few years, you're also going to develop autoimmunity. So, not in babies, but in older children, we found that they start producing antibodies against their own skin cells, against their keratinocytes. And once you have that, it's very difficult to treat. So, I'm just going to have a word on exposure to food. And this is for eczema. For eczema, exposure to food occurs through the skin. But there are different ways you can get exposed to food. If we talk about food allergy, of course, eating, drinking, smelling, inhaling means all contact with food. And of course, prenatally, when you are a fetus, certain food can cross the placenta, and fetus come into contact with the food that the mom eats. And also breast milk. Breast milk is the best, no discussion. I respect all the formulas, but I'm sure there will never be a formula better than breast milk. But sometimes breast milk can contain traces of food, and this can cause food allergy in the baby, which is never a reason to stop the breastfeeding. But you will have to ask the mom to stop eating or drinking that food, but only after a detailed diagnosis. So now you see that children with eczema, they have an extra contact through the skin. And it's not sure whether if you have a normal skin, this can happen. It has not been shown that people with normal skin can sensitize themselves through the skin. But it has been shown in children with eczema. And this is how we look now at food allergy, and mainly food allergy in eczema. We think that cutaneous exposure, and this is eczema, not all children, we think that cutaneous exposure through the skin causes allergy because it's contact with very small amounts. Eating and drinking is exposure to high amounts. It's like immunotherapy, and high amounts are mainly related to tolerance. And this is a slide that is not representative for all food allergy. This is a slide representing